Assalamualaikum. My name is Aisyah Aziz and I am from third year dental student FPG USIP. So today I would like to do oral hygiene instruction demonstration. What we have here is my oral hygiene instruction kit, the oral hygiene instruction card, educational card, and also my teeth model for the toothbrushing technique demonstration. I have been given a situation where there is a lady, 21 years old lady, come to the clinic with the chief complaint of bleeding during toothbrushing. So she really afraid that her oral condition is related to any pathological condition and even cancer. So what do we have here is all this instructional key to educate her and to give her some sort of information and also education on how to improve her oral hygiene, because actually her condition is related to gingivitis. So in this educational video, I will explain to her about the anatomical structure of the teeth, because we want our patient to some sort of appreciate what they really have in their oral cavity. Secondly, we will explain to her what is plaque, because we all know plaque is the culprit of all oral disease. So she must know this. Last but not least, with all this pathological condition of the oral cavity, I will explain to her on how to curb this oral health disease condition by correcting her toothbrushing technique, the flossing technique, the interdental cleaning that seldomly being taken into consideration by all of us. So yes, let's get started. This is the anatomical structure of a tooth. You can see there are three layers that line the crown, which is enamel, dentin, and also pulp. This blood vessel and nerve will line all the tooth from the apex, which is the root of the tooth, up to the pulp chamber of the tooth. And between the gingiva and the tooth itself, we have this little space which we call sulcus. So basically, sulcus is actually where the plaque formation happens, because when we eat, there are high probability of the food track in between the sulcus. So by time, these food debris will in turn progress into the plaque formation. We have learned on how tooth look like. So right now, I will explain to you what is actually mean by primary teeth and also permanent teeth. The primary teeth is, we call that baby teeth. It's not, when we call it is primary, it is actually not permanently there. It is there to just maintain the space for the developmental growth of the children. And for the primary teeth, it has 20 sets of teeth overall. And for the permanent teeth, the teeth that we have right now, it has 32 sets of teeth. Sets of teeth is called permanent because when we have some oral condition that needs the tooth extraction, there will be no longer teeth that will substitute the tooth loss. Next is the dental plaque, because as I said earlier, it is the culprit of all oral disease. Many of us actually they tend to confuse between plaque and also calculus. Plaque is actually a smooth deposition where calculus can only be removed with the professional mechanical plaque removal, which is scaling. What is actually plaque? It is food debris? No, it's not food debris that attach to the surface of the tooth, and it's actually produced daily. The dental plaque itself is actually the soft deposition of the bacteria, or we call it biofilm. Because of that, we need the correct toothbrushing technique to remove the plaque and also to disturb the plaque formation. By time, if the plaque formation is not disturbed by toothbrushing, I mean in a simple word, if we don't brush our teeth, this will lead to the calculus formation. It will progress to the calculus formation. When the calculus is formed, it is firmly attached to the surface of the tooth, mainly in the sulcus. So right now, I have a comparison of a healthy gum and also gum with gingivitis, or we call it the gum disease. So we have here the healthy gingiva. It will have pinkish color, whereby the inflamed gum of the gingivitis patient, they will slightly reddish than the healthy one. Next is about the interdental gingiva. As you can see between the teeth, there is a scallop of gingiva. In healthy person or healthy oral cavity, the interdental papilla is slightly sharp. As we see here, it is blunt, right? It's because of the swollen gingiva. And next is about the stippling. The stippling is produced when the gingiva is firmly attached to the bone itself. So when there is inflammation, there will be inflamed gum, so the stippling will be absent as well. So we can say it is healthy gingiva by the presence of stippling. This is mainly because of the plaque. Actually, your condition is related to gingivitis. Why? Because when there are inflammation around the tooth, there will be our body will help to fight the bacteria by producing the inflammation reaction. So because of that, there are lots of blood vessels around here, and your gum will tend to bleed easily during the toothbrushing. As we can see, how can we reverse back the gingivitis? Of course, by toothbrushing. It will take about 3 to 4 days to reverse back the condition from where you have the gingivitis to the healthy gum. This is the progression of the gum disease, where we as a clinician, we will diagnose it using the probe here, and we will insert the probe into the sulcus. This is we call the CPITN probe. So in a healthy gum, the probe can't really go into the sulcus because there is firm attachment of the gingiva and also the bone. But when the gingivitis happen, this will lead into the bleeding of the gum when we insert the probe into the sulcus. Overall, the gum disease can be divided into gingivitis and periodontitis. So what is actually mean by both of these? When we call it gingivitis, it is actually inflammation of the gingiva. As for the periodontitis, what makes it different from the gingivitis? When we say this periodontitis, it is the inflammation of the periodontal tissue. So when there are inflammation of the periodontal tissue, because we know that periodontal ligament is actually the attachment of the tooth to the bone. And when there are inflammation of the periodontal ligament, there will be disruption in the attachment of the tooth itself. So there will be gingival recession. We can see the tooth slightly getting longer. It's not the tooth getting longer, but it's actually the gum itself recedes downward. And it's actually, there is also space, because when the gingiva recedes, the part of the root is exposed. Therefore, it seems to have some space in between the teeth. And also, when the attachment is disrupted, there will be mobility of the tooth, and this periodontitis will even progress to advanced periodontitis, where they will eventually experience tooth loss. The thing that we must know that plaque is not only will cause gingivitis but also will cause caries progression, because when there are plaque formation around the tooth structure, there will be byproduct of the bacteria. As we all know, all the byproduct itself is acidic. So these acidic materials or acidic substances will demineralize the tooth structure, because caries happen when there are demineralization of the surface. When the demineralization of the tooth structure happen progressively, it will lead to the formation of the caries. The caries started at the enamel, and also it will progress into the dentin, and lastly, it will go into the pulp. When this happens, there will be some sort of complication. The treatment is either the root canal treatment, and also tooth extraction. Caries always started at the pit and fissure because that's the place where the plaque easily formed and hardly can be reached during the toothbrushing. So it will start at the pit and fissure of the tooth itself. So right now, I have already explained about the importance of the tooth structure, the plaque formation, and also the condition that we call gingivitis and periodontitis. So right now, I will show to you what is actually meant by the correct toothbrushing technique. Because some of us, yes, we do brush twice time daily, but the effectiveness is not there. So this actually will lead to the plaque formation and yeah, gingivitis will happen. So yeah, I will show you. This is the recommended toothbrush to be used during the toothbrushing, which is it have, as you can see here, it have very soft bristle to ensure that this toothbrush will engage in between the sulcus where the plaque formation happen. About the toothpaste, we must make sure that the toothpaste we are using contain fluoride, because actually fluoride is some sort of, we can call it a nutrient for the teeth, because fluoride can strengthen the teeth and also can remineralize back the demineralized part of the teeth, so that we can stop the progression of the caries from the early lesion back to the normal condition of the teeth. So how to brush our teeth? I will use this toothbrush to demonstrate. The toothbrush will place at a 45 degree, so facing the gingiva, because we want to make sure that this smooth bristle of the toothbrush engage to the sulcus area. Gently move the brush back and forth in a tooth-wide stroke. So you brush like this to all the tooth surfaces, the outer surface and also the inner surface and also the chewing surface. Make sure it is 45 degrees so that it will engage the sulcus. If you want to make it more effective, when you brush the inner surface, make sure to make like this so that the debris or the plaque will just disturb, so that we can disturb the plaque formation and also can remove the foot thread from the sulcus itself. But there are conditions where patient can hardly reach the posterior part of the tooth. So we recommended this kind of toothbrush, which we call single tufted toothbrush. This will in fact help us to reach more posteriorly and reach the posterior area of the tooth. Next one is for the interdental oral hygiene. Actually, toothbrushing wasn't enough for us to make sure that all oral health is free of plaque. Therefore, we must use we call the floss for the interdental cleaning. So we use this to clean the interdental cleaning so that there are no plaque formation between the teeth. Here, make sure it goes straight to the sulcus. And yeah, we can remove the the plaque formation just by flossing. Next is the interdental brush. As you can see, there are various colors that indicate the size of the brush. So this brush is vitally important for those who wear braces, or even for us to make sure that we have already cleaned the interdental part very thoroughly. I think that's the end of my video. So I have already completed my oral hygiene instruction with this oral hygiene instruction kit. So I will hope you enjoy this video. And yeah, dentistry is not expensive. Neglect is. Thank you.